MRI of the hip, knee and ankle. A morphed image of the MRI scan is then circulated and sent to us for validation. This is actually some sort of a virtual surgery, because on the basis of the templates that are provided, on the strength of the images that are captured by the MRI scans, we get a very accurate index of what the deformity is, what amount of correction needs to be done, and we get a template on which the company from Belgium actually fabricates a sizing option. The option that they give us is something that we can change depending on what we feel, and it gives us the freedom or the flexibility, if you like, to actually do the patient's surgery well before it's actually done. So it's really like a virtual surgery. Once this exercise has been done, we validate this configuration, send it back to the company, and approximately between 15 and 20 days later, we get a mold. It's a type of a protocol, it's a type of a block, which is actually the image of the patient's knee. Now these are cutting blocks which help us to accurately use in terms of restoring the alignment. Most patients undergoing knee replacements have the alignment of their knees in relation to the hip and ankles out of place, and using these validation blocks we can actually realign the procedure. Put very simply, what it does is it takes away the human element out of the technicalities of the surgery, so it makes this a far more predictable and a reproducible option. So we use this quite a lot, and we had this option with Mark. I'm glad to say it worked out well, and he's undergone the surgery. He's done very well. We're extremely pleased with his progress. He's flexing his knees about 2 weeks from his index surgery. He's just had his sutures taken out today. His wound's looking good. He's already flexing to about 115, 120 degrees, which is remarkable. And I suppose some part of it obviously goes towards the effort that Mark has. He came in focused, he wanted to get better, so he's had all of that stuff. And obviously having this technology played its part, and we use the high-end flex implants which give a enhanced range of movements. We expect that his knees should flex to about 135 to 140 degrees, and I expect that movement to be achieved in the next about 2 to 3 weeks.
That's wonderful. Mark has been reporting that he's feeling better day by day, even though he's been doing a lot of physiotherapy very regularly. And he's also told us he's paid about only $800 for all this, the protocol, which I believe is not a very big amount for the Indian patients also. And I think it saves a lot of operating room time also, because we've seen lots of other hospitals typically take 3 hours, 4 hours for doing a knee replacement surgery. So they are probably trying to do what you do beforehand. They try to do in the operating room, just trying to fix the knee, based on the patient. So this allows you not only to achieve better results, but also do more patients.
Yeah, I guess so. Obviously, whenever you operate, you want to optimize on your time management. It is a surgery which involves a large foreign material to be implanted into the human system. Clearly, the less time that the knee or the wound remains open, the better it is from the patient's perspective. But for us, the main advantage of using these technologies is to achieve a predictable and reproducible outcome.
I'm pretty happy to be with you, Dr. Rajgopal. As I love to say, you are a phenomenon. You put India on the world map with the latest advances and the kind of work that you're doing. Truly, you're a Bharat Ratna material when it comes to the healthcare. You're absolutely the king in the field of knee replacement.